and knows how you can take control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies, or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellecare.com. That's rosellecare.com.
Breast cancer is a major health risk to all women. It can silently grow uninterrupted for years. The Thermography Centers of Fairfax reminds all women to conduct monthly and annual breast exams. Consider a thermography scan from the Thermography Centers as an adjunct to your routine breast exams. Digital infrared thermal imaging is safe and non-invasive. For more information and to schedule an appointment, call 703-520-7591 or visit thermographycenters.com.
Are you dental phobic? Do you neglect your dental health because of fear and anxiety? A beautiful smile begins with exceptional dental care, and you can trust in the expertise of Soft Touch Dental Care and Dr. Michael Chung. Soft Touch Dental Care is unlike any dentist office you'll ever experience. Their warm and welcoming environment is designed to soothe fears and anxiety the moment you arrive, and they're especially pleased to pamper their honored guest patients. Dr. Michael Chung is a professional and leading expert in all areas of comprehensive dentistry, including cosmetic, sedation, neuromuscular, TMJ, and implant dentistry. Offering state-of-the-art technology, Dr. Chung can give you the smile of your dreams. Arrange for a complimentary consultation today with Dr. Michael Chung and experience the expertise that makes Dr. Michael Chung so unique. Call 703-319-6990. That's 703-319-6990. Or visit bestinsmile.com. That's bestinsmile.com.
This is Dr. Tom Roselle, author of Ageless Health. Health is a do-it-yourself program. My book, now also available in audio version, is a step-by-step program of how to take control of your health and wellness without drugs or needless surgery. You have the capacity to change your health and level of well-being. Take control of your health today and order Health is a Do-It-Yourself program.
For more information and to order, please visit agelesshealthbook.com. That's agelesshealthbook.com. Educate, engage, empower. Take control of your health with Dr. Tom Roselle and the Roselle Center for Healing. Information is power. Achieve an ultimate state of wellness with Dr. Tom Roselle's Education Lecture Series video on demand. Discover how to create an extraordinary life of optimal health and wellness. Visit drtomroselle.com/education. That's drtomroselle.com/education.
The information provided on Dr. Tom Roselle Live by Dr. Tom Roselle, D.C., interview guests, show co-hosts, or substitute hosts is not intended or implied to be a substitute for professional medical advice, diagnosis, or treatment. It is for general information purposes only. Information from this broadcast should not replace the appropriate consultation and examination process by a licensed physician. Always consult your own physician prior to changing any current medical directive or prescription.
Hey everybody, Dr. Tom Roselle here. Welcome to Ageless Health with yours truly, and we're going to continue the process of talking about something that is really important. We're talking about neuropathic pain, neuropathy, but as it comes from maybe your liver and bad, blood sugar transport systems. So we want to make sure that you understand that there's a way out of this mess. There's a lot that you can do to reverse it, but first you have to know the signs and the symptoms and not ignore them. If you ignore them, that's where you get in trouble. That's where the, oh my God comes from. I didn't know. Now what can I do? And sometimes by that time it's too late because, you're starting to notice this black stuff at the end of your toes. That's called, a bad sign. And if it's there, and it's a gangrenous type of condition, gangrene, you may lose a toe or two. And we want to stop that. We want to reverse it. There are many different types of neuropathic pain. And some of them are very straightforward, easily recognizable, and they can be reversed. Some of them, you got to dig a little deeper. You can't just broad brush them and call them all the same thing. So on December the 11th, which will be the last class that we'll be doing here at the Roselle Center for Healing for 2024. Got a great year coming up, by the way, all kinds of things there. But we're going to have a very special evening. And it's going to be, you're going to get triple teams. It's going to be Dr. Scott Lamp, it's going to be Dr. Jerry Cowart, and myself. And we're going to be talking about diabetes. We're going to be talking about neuropathy. We're going to talk about gout. We're going to talk about what happens to liver function. We're going to talk about what you can do to reverse it. We're actually going to show you some equipment that we use to reverse these things very exponentially. But here's one of those conditions that truly, truly, truly encompasses all three sides of the triad: the structure, the neurological platform, the biochemical platform, and also the emotional platform. Because I promise you, if your blood sugars are off and you have neuropathic pain, it's going to affect that expression of your emotional reaction, if you will. So we want to be able to get into that. And by the way, if you come to the class on the 11th, I have a very special Christmas gift for you from me, yours truly. And setting aside everything, many of you know that if you come to the class, that we always give you an opportunity at a discounted level to come in and get a full examination. But this is something that's not going to cost you anything. It's a gift from me. Many of you know that over the years we had the opportunity of doing several things with a tag called Ageless Health, right? Well, Ageless Health was coined in, we got to go back 20 years now, and I was using it on many different platforms. Well, my first book, Ageless Health, Health is a Do-It-Yourself Program, obviously was about that. And then PBS did a Emmy Award nominated TV special, if you will, called Ageless Health, the TV special. We had several other things like that, but I did not only my book, but I did an audio version of it as well. So I'm going to give you, those of you that show up, I will give you as a gift the CDs that are Ageless Health, Health is a Do-It-Yourself program, but you're going to be there, and it's yours truly narrating it. And again, that is my Christmas gift to you. So if you show up on the 11th, and all you got to do to attend that class is go online, go to drtomroselle.com, or call the office, 703-698-7117, or go to rosellecare.com and sign up for the class. But please, 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 if something gets in the way, I know it's the holiday season and you can't come, please make sure that you call and cancel so we have the space for other people to come. But those of you who have never been there and you have a double win coming up. One, obviously you'll be invited to come in at a discounted rate to see if there's something. There's no harm, no foul. We're going to get in, we're going to show you the equipment that can be used to reverse neuropathic pain. There's things that you have to do. We're going to do a step-by-step and tell you how to move that in that direction. And then yours truly, will give you a gift that you don't have to spend 5 cents with. That's has to do with the CDs of Ageless Health, Health is a Do-It-Yourself program. Now, the one thing that I will ask you to do, go to Caring for Others, LTD.org. And it's our foundation. You can find it straight up on the web. It links from all of our different sites, from rosellecare.com to drtomroselle.com. And Caring for Others was designed back in 1998 to help those less fortunate, to take care of people, young people that are going to chiropractic, acupuncture, naturopathic, nutrition schools, and we give scholarships on an annual basis. We'd like your help. We would love to have your help. And all you have to do is make a donation. You can make it right online, a secure site, and help us help other people who are less fortunate, particularly this time of the year. Now, the last piece I want to give you, since we're going into this holiday season, is that if you would like any of our doctors in the first of the year to come and lecture to your groups, no matter who they are, church group, social group, the VFW, the Elks Club, the Moose Club, any of those, we work in tandem with caring for others. And we have to make sure that we do public education at no charge. And we will do that as a gift to you. On any topic on healthcare that you would like us to address, happy to do that. All you have to do, again, reach out. Your contact at the office would be Sybil McFarland. Call her or ask her to call you back and set that up, and we'll be more than happy. Let's get into the program. We're talking about your hands and your feet and your face, and it can be your face, by the way. It could be your lips. It can be your fingertips. It can be, everything. So what's the deal here with diabetes? Why are we problematic? Why are we so concerned? The tingling or pain in your feet or hands can be multidimensional, but if it's a diabetic neuropathic problem, that pain is a warning sign. It's telling you that you better step up and do something about it now before it gets to the place where you can't do anything about it and it's destroyed the neurological endings, and it can happen that way. Just because you're taking different types of diabetic medications doesn't mean that it's going to reverse any of this. As I said earlier on the radio program on WML 105.9, that if you have this diabetic neuropathic pain and you're celebrating it because you're taking medications and because your A1C just dropped under 8, it's like you still got a major problem. Your nerves are still being destroyed. And a lot of the medications you're taking will enhance the destruction. Look up the side effects of these things. All you got to do is go to drugs.com, and look it up and see what it says. You can get a feeling in your hands and your feet. It's like wearing too tight gloves or too tight socks. And you're going to have a super over-the-top sensitivity to just even light touch. It hurts. It's painful. So don't ignore that. There's loss of balance. I kiddingly said, on the radio program, that there's only a couple things that will give you the loss of sensation that you can't feel your feet anymore. One is diabetes, and the other one is syphilis. So let's look at the most common. You remember the whole axiom of, when you hear hoofbeats, look for horses, not zebras. Well, let's look for the most common. It's probably blood sugar transport. What's even more common than that, by the way, it can be your low back. It simply could be the lower portion of your spine where the nerves are being irritated, overstretched, or compressed, or an inflammatory reaction due to something. But we're going to show you how to identify that on the 11th, coming up December the 11th, which will be the last class that the Roselle Center will do for this year in 2024. Next year, we got a great calendar for you as well. But this will be the last one for this year. So don't miss it, because we won't cover this topic again until maybe next year and way into the year. So join us. And remember that I have this very special gift for you if you do come. So muscle cramping, twitching, loss of balance. And guess what one of the crowning jewels is? That you have all these other things. The thing that said, yeah, you got a problem. Your blood pressure starts fluctuating, your pulse starts fluctuating, and you really have to understand it. If you get that numbness or tingling in your hands, your doc sometimes will say, well, you have carpal tunnel. Maybe you have carpal tunnel, but that's usually one nerve, not the entire hand that's involved. That inflammatory reaction of that nerve that goes right down the middle of your hand. It's the median nerve. It's like this. It's not over here. It's not over here. These are neuropathic problems that can be coming from your spine, but carpal tunnel is this one. It's right here. It's the median nerve. And then it goes into the thumb and it goes into the index finger. So you have to find out what it is. It can be triggered by all kinds of things, and it could be any kind of organ disease. But guess what? Thyroid problems can be a problem that can present that. B12 deficiencies. The list actually goes on. It's huge. I'm letting just the fine points of things that are the most common come to mind right now. But also, don't forget medications, particularly if you're on chemotherapy or some type of immune suppressive drugs. You're going to find that the most common symptom often is neuropathic types of presentations. If you have low levels of B12 and folate in your body, you're going to have neuropathic pain. And we talked early on about autoimmune diseases and suppressions and infections. Lyme disease will cause it. Hepatitis will cause it. COVID will cause it. And we have to be able to identify that and not just as, oh, well, you're going to have to deal with it. Not so much. So guess what we need to do? We need to first understand it. We have to look at lifestyle. Then the next thing we have to do is, how do we reverse it? And can it be reversed? So I'm here to tell you that the majority of these things can be reversed and can be reversed permanently, but you have to identify it. There are some that have gone too far, or there's some that are being treated improperly. And so subsequently, they're not going to be able to be reversed and be resolved. So we have to understand what that is and make a difference accordingly. But you can't do it just by taking a medication and hope that it'll go away. In the program that we just got done with on WMAL, we talked about the relationship between gout and diabetes, or gout pain and neuropathic pain and diabetic neuropathic pain. So they both have liver relationships, and there's where the commonality is. If the liver's working well, it's unlikely that either one of these conditions are going to be problematic. And they can be triggered by similar things: alcohol, carbohydrate intake. There's some that are very distinguishing between the two, but gout and peripheral neuropathy are distinct conditions that can be diametrically different in their triggers, but they have many common triggers as well. And those are the things that we have to be aware of so we can rule one out from the other. So can gout cause peripheral pain? Sure it can. Can it cause nerve damage? Sure it can. So we have to look at the two patterns and be able to distinguish between them and be able to understand what it is that we're looking for and how to treat them. On the 11th, we're going to show you how to treat them. I'm going to show you equipment that's being used not only in our office under very specific situations, but in other offices, unfortunately, generally. Other offices are going to be using injections. They may use stem cell injections and PRP injections and things of that nature, but they're also going to use things called a deactor. Can they work? Sure, they can work. But we have to understand that diabetes and liver function are closely related, and you have to get rid of the cause before you can reverse anything. Diabetes can cause progressive scarring in the liver. It can lead to an injury of the liver called cirrhosis or fatty liver disease. It can speed the progression of any kind of internal problem, increase the risk of life-threatening problems like liver failure. By the way, if your liver fails, guess what the next organism to fail is? Because your heart. Your liver can shut the heart down. There's patients that we've known that have been sick and they, start taking, a little bit of whiskey for their lung problem, or shut their liver down, the liver shut the heart down. It's unfortunate that we're never taught those things. But if you're one of my patients or a patient here in the office, you're going to hear a lot of things that your normal physician hasn't told you. And the best way to get them to step up to the plate is ask the right questions. And I promise you, if you come to the class on the 11th, you're going to have a ton of data to be able to ask the right questions. But remember that we're going to have a very special gift for you, and it's going to be the audio version of Ageless Health, Health is a Do-It-Yourself program. It's my gift to you. And remember that if you do come to the class, as well as every class we do, you're going to have the opportunity to see one of our doctors at a reduced fee. We do that as a thank you for showing up. And wouldn't it be great to be able to have the information? No harm, no foul, no obligation, but you're going to be able to understand it, and you're going to understand it very, very well. So let's get into just a little bit more in depth. So what we want to understand is something called glyconeogenesis, and that's what that is the conversion of a storage of glycogen to blood sugar, glucose, and then the transport into the areas that it needs to. Glyconeogenesis refers to a metabolic pathway, if you will, that there are several organ systems that need that blood sugar transport. It's called glucose, not fructose, but glucose. And your mitochondria in your brain and your heart needs them, but also the muscle patterns. So it's regulated. That whole pathway, that glyconeogenesis pathway, is regulated uh, in total by hormones called insulin and glycagon and cortisol. And so cortisol is what? That's your adrenal glands. And insulin is what? Your pancreas. And the storage of your blood sugar in your liver is glucose in the form of glycogen. And so we have to be able to understand how all three of those systems are influenced. I said three, right? What am I talking about? I'm talking about the liver. I'm talking about the adrenal system, your fight flight system, and I'm talking about your pancreas. They work together to balance blood sugar reactions. So if you're stressed out, if you're eating like crap, and you're in pain, you're never going to get rid of the diabetic pattern. And if you're trying to specifically down it with medication, it's going to affect the liver again, or alcohol to put the reserve down. You're in trouble. So let's find out how to reverse that whole situation. So here's the deal, right? The basic patterns of this regulatory mechanism that we just touched upon is actually quite amazing, but it's very specific. There's multiple factors that contribute to the regulation of this blood sugar transport. Enzymes, number one. So what are enzymes? Enzymes can be things like bromelain and papain and amylase, and the list goes on. Actually, it's quite in depth. And it helps put the fire out. It helps break things up. It helps reduce the carbohydrate load in your body. But if you're constantly eating things you shouldn't eat, then you're going to have this condition that you're hearing all over the place now called what? Pancreatic insufficiency, or PI. We've known about pancreatic insufficiency for years. The drug companies are just trying to figure out how to make money off of it. But that's on you because you've been bombarding your system. If the nerves in your spine that go to the pancreas, if the 10th cranial nerve, the vagus nerve, is not working the way it's supposed to, that organ system and other organ systems are not going to work. If it's constantly being, triggered to produce insulin, pretty soon it's going to get tired, just like you going for too long of a walk or a run or working out. You're going to get tired too. Well, the organ systems are no different than that. So we have to stop beating them up. We have to begin to lower the threshold so they can repair themselves. So we have to understand that there are different things that the body needs. And this whole transport system, this whole reaction that's involved in what we call glyconeogenesis. Genesis meaning what? The production of, the initiation of blood sugar transport that cells need, but in the right form, in the form of glucose. Not the other garbage that's out there, not the fake stuff, not the artificial things, but the things that it really needs, that your body already has, that's storing itself in the liver and in muscle tissue in the form of what? Glycogen. And you have to make sure that you can trigger all those pieces of the puzzle. Now, you have to make sure that you protect and control the enzyme pathways that are involved in all of this. Because if you don't, you're never going to be able to fix it. You're never going to be able to turn it around. So we have to understand what are the steps that, one, got us into trouble to begin with. You have to understand why. And then secondly, what are the steps to get us out of trouble and get this glyconeogenesis metabolic pathway working the way it's supposed to. And so this glyconeogenesis, again, to recap, is a metabolic pathway that results in the formation, biosynthesis of what? Glucose, sugar, but the right kind of sugar, glucose, from certain non-carbohydrate substances. Kind of interesting, right? And the problem is that it's ubiquitous and it's present in plants and animals and bacterium and all kinds of things like that. So if we understand it and we can understand what might suppress it, wouldn't it be great to be able to say, oh, is that why I can't feel my feet? Oh, is that why that my toenails are turning all kinds of funky colors and some blackness in there? Oh, is that why that I don't feel my legs anymore and they feel weak and I'm going up and down stairs is a problem? Could be. But if that's the case and you knew you could change it and you did nothing more than cut the garbage out of your mouth, stop eating all the fast acting carbohydrates, put your diet into heavy, good, concentrated, clean proteins on a regular basis throughout the day, and going to vegetables and nuts and seeds and things of that nature, and going nothing more. Go out for a 2-mile walk every day. I didn't say how fast, just go out for a walk. Go out for a walk. And if you did those things and you flushed with a lot of water, your chances of re-regulating your system just doing those things are great. And then you add things like vitamin B complex, and you add zinc, and you add chromium, and you add berberine. All of a sudden the body begins to shift. Now, if you have a whole history of an inflammatory reaction, or if the nerve roots are being irritated, or if you've already got damage, now there's other things that can be done successfully. And we'll tell you what those are, particularly on the 11th when we go through there. But if you did nothing more than what I just told you, you can make a huge difference, a huge shift in that inability to feel your feet, that numbness, that tingling around your face, your lips, right? Your ears, your whole body seems to be doing that all the time. It's not okay. So you need to understand what takes place. When we look at the spinal system, and we look at the nerves that go to the different organ systems, I can walk up to you. If I know that you have a blood sugar transport problem or neuropathy, I can put my finger right in that nerve root that is causing you the problem. And you're not going to like me very much because it's going to hurt. But it's two things that are taking place. One could be just the nerve was irritated and you haven't paid attention because you got something that's pinching it. Or secondly, you got a feedback loop from the organ to the spinal level, from the spinal level to its distribution in the muscular pattern. And we're going to talk about that. And we're going to make it simple. We're going to make it so you understand it. We're going to make it so you can ask your doctor the right question. And we're going to talk about foods that will actually begin to heal your body. And things like blueberries, right? And cranberries and beetroot juice, even beets, straight up beets. And wild caught salmon, and by the way, I stay away from Alaskan salmon. That's just me. I keep remembering Fukushima, the energy meltdown out in Japan. So I kind of stick to Norwegian salmon and things like that. And, olive oil and things that nature will make life a whole lot better for you. But there's signs that you have to pay attention. There's warning signs. And the problem is that we ignore it. And then pretty soon it's too late. Then we go to the doctors. And in today's world is take this for these symptoms, right? Not okay. Listen, on the 11th, December, coming up at the Roselle Center for Healing in Fairfax, please register for the class at rosellecare.com. Or go to drtomroselle.com. You can register either way. And remember, if you come, I got a very special gift for you, but you got to be there because I'm not going to send it to you. And it's going to be the audio version of Ageless Health. Health is a do-it-yourself program. My gift to you for coming. And, it's why do we do things like this? Simply because I want you to be well. I want you to be able to turn your life around. I want you to be able to shift and change virtually anything that happens to you. So please, 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 there's only a few seats left. This class is going to be over-attended, so don't waste time. Call now. Call now. Make a reservation. Or go online and make the reservation. But I want you there. And if you can't show, make sure you let us know. But remember, there's only a few seats that are left. And, we can sit you on the floor maybe, sit you out in the hallway by the elevator. but we don't want to have to do that. So give us a call now and let's see what we can do to make your life better, get rid of this neuropathic pain, show you what to do about it, and live a life that's better. We're coming up to the end of the program. And for today, not for today, you can't shut me up that easy. We'll continue a little bit more next week. But the 11th, join me at the Roselle Center for Healing. Dr. Scott Lamp will be with me. Dr. Jerry Cowart will be with me. And we're going to triple team you. And we're going to give you as much data as we possibly can so you can live a far better life than you thought was possible. You thought it was all down tubes from here, but it isn't. You can reverse this thing. Remember, I'm here every week with a brand new program, the radio program, Dr. Tom Roselle Live, WMAL 105.9. And I do this for one reason only. Not only do you deserve the information, but simply this. I love you all. Have a great day. Bye.